evening, everyone. My face and name may be familiar to you. Because of the generosity of the Dean's Global Health Fellowship, I was able to spend this summer in Tanzania working on an exciting and innovative project geared toward curbing the HIV epidemic. To remind you, my name is Natalie Dickson, and I'm a third year in the dual MA-MPH program in African Studies and Community Health Sciences. This summer, I traveled back to East Africa to the bustling urban center of Dar es Salaam on the Tanzanian coast. I also spent a part of my time in Kisarawe, a rural area about 2 hours outside of Dar es Salaam, depending on traffic, known for a relatively high HIV rate. This summer allowed me the opportunity to see the other side of public health work, as I was a central part of the project management team. Specifically, I served as a qualitative consultant and assisted with hiring our qualitative interviewers, developing our qualitative guides, and created training materials for the team. I am happy to still be working with the project and participate in weekly Skype calls to stay updated on the progress. Try coordinating time zones between LA, South Carolina, and Tanzania. The qualitative work this summer yielded important data to developing an appropriate intervention for the main portion of the study, which is actually beginning in Kisarawe this month. In the qualitative portion of the study, we were interested in learning what community members in Kisarawe think about things like HIV self-testing through a saliva swab, pre-exposure prophylaxis, also known as Truvada, which is the daily pill that you take to prevent HIV, and ART initiation upon diagnosis of HIV. We are focusing on HIV serodiscordant couples because these units have evolved as a concern for the increasing HIV epidemic in sub-Saharan Africa. While we are still analyzing the data, a variety of important ideals are emerging. Issues I never considered, like a wife swabbing her husband's mouth while he sleeps to see his HIV status, became insightful commentary for the team to consider as we're developing the main intervention that's going to continue for the next 3 to 4 years. It's important for us to consider these things we learn from the qualitative interviews when we are learning how to market and to talk about things like self-testing and pre-exposure prophylaxis within the context of our study and within the context of HIV serodiscordant couples. This summer has also taught me the importance of ethical public health work. I was able to join this team because of my previous experience in East Africa, because of my language skills, and because of my understanding and respect for the complex socio-political context of the country. We should be striving to learn about the communities we work in and not just leaving at 5 p.m. We should be living, working, and learning together every day and making every effort to speak the language, understand the culture, and learn the history, no matter how uncomfortable that may be. If we truly want to be the best global health scholars we can be, we owe all of this to the communities we work with and to the communities we're sending our students to. Trust isn't built because you have an MPH or because you have a PhD. Trust is built when you see the same old woman every day making breakfast outside of her house and you're able to greet her in the local language. It's all about mutual respect and reciprocal teaching. It is paramount to internalize this reality if we are to keep pushing our global health work to new standards. This is what public health is about, and what I and my colleagues will continue to advocate for throughout our global health careers. Thank you for your continued generosity.